Now, the 26th International AIDS Conference is taking place in Rio de Janeiro in Brazil, and virtually comes at a time where, in fact, a crucial time, one would say, for the HIV response. In the face of an unprecedented funding crisis and major cutbacks to HIV programs, the world's largest conference on HIV and AIDS is bringing together people living with HIV, researchers, policymakers, healthcare professionals, funders, media, as well as communities. So for more on this, we're joined now by SABC specialist health researcher Zandile Myeza, and who is in Rio de Janeiro for us. Zandile, good evening to you. And of course, a lot of focus and quite an important conversation here. So the HIV epidemic is being discussed at a global level. So how important is this, and for South Africa in particular?
A very crucial time in the global response to HIV, Bongiwe, because there has been a lot of scientific breakthroughs, but these have been met with sudden funding cuts that have had a ripple effect on communities that need these responses the most. So the HIV conference is going to be looking a lot at what key elements are needed to drive the response further. There's been a lot of talk so far in just a few hours ahead of the opening plenary about long-acting preventative treatment and lenacapavir. Those are some of the things that have come up so far. The funding crisis has also come up, and we expect that this will dominate talks throughout the week. But I am now joined by Deputy Minister Dr. Joe Phaahla in his capacity as the delegation head for South Africa at this International AIDS Conference. Dr. Joe Phaahla, thank you for joining us, Deputy Minister. Please talk to us about why it's so important for South Africa to be part of the conversations that are about to take place this week.
Well, it's indeed very important for us because, as you may be aware, we face the highest burden of HIV and AIDS in the world. And we have the biggest testing and treatment rollout of all countries in the world. So the changes which are happening do affect us quite a lot. But we know that we are not on our own. We are here as South Africa, of course, but also just this morning we had a session with our SADC partners, the SADC region and the African continent as a whole, and also the countries of the South. So we are here in solidarity, although we are the highest burden, the highest challenge, but we are together with many other colleagues, not just as governments, but also especially with civil society.
Interesting developments, Minister, around long-acting prevention and treatment tools. On the backdrop of lenacapavir, there's been some really new scientific developments that have come up. What's in the pipeline in this regard?
Well, I think the biggest story, of course, is the issue of the long-acting injectables. There was, of course, the previous one which have been used and kept, and then we've got the lenacapavir, which is even more in the sense that it's more long-acting. The others were about a month, 2 months, but this is 6 months. But we also expect at this conference a lot of other innovations, because as you know, from the press conference which I've just come from, and where, with the International AIDS Society conveners, we're also together with UNAIDS. The emphasis, of course, is on the fact that it's good enough for researchers, for scientists to come with new tools, but the question is, are they accessible? So it's to make sure that when these tools are found to be effective, like lenacapavir, which is proven to be almost 100% effective in prevention, they have to be accessible. But during earlier on, of course, one of the scientists from our own country was also telling us on another prevention, which is more of a pill over and above. There's also a pill, an oral pill, which is also long-acting in terms of a month. So all those things, because, not everybody, maybe, for instance, can take the injection. So the interesting thing is to find all these combination tools, which, can be available, because we have set the target as a world under the UNAIDS to say that we must eradicate HIV as a public health threat by 2030, which is just 4 years from now, not even less than 4 years. So we have to really bring all the tools on the table.
Minister, we just came out of a press briefing and you spoke quite strongly about regional self-reliance for the African region in terms of domestic funding. In the context of the conference theme, how important is funding for the African region in the context of the theme?
Well, as we said, and a number of panelists did stress, there is no debate about the fact that countries have to mobilize more and more of their own domestic funding. But we also say that you can't rewrite history. We can't rewrite history on the fact that many of our countries, in terms of the disadvantaged economic situation they are in, was not by force of nature. It was human activities, colonialism, exploitation, which led to the situation of inequality in which we are. And we are saying that it is a time, this is not the time for solidarity to be thrown out. For those who are more advanced in terms of wealth and those who are still struggling, because at the end of the day, as we said at the top of the COVID pandemic, that no one is safe until we are all safe. Solidarity remains very critical at this stage, so that as countries improve their financial resources and investment in their health services, this should not, the issue is this abruptness of where some of the donors, some of the countries which has been in partnership with countries which are highly burdened, suddenly just pull out and collapse programs. We're saying that cannot be good for global health security. So we of course agree as an African continent that we should keep on improving, but that must be properly managed so that the programs don't collapse.
Thank you, Deputy Minister.
Thank you.
Well, Bongiwe, that is the Deputy Minister of Health. He is leading the delegation for South Africa here at the conference. The opening plenary is just a few hours away. And from us in Rio de Janeiro, Brazil, we'll be bringing you more updates after the plenary. It's back to you in studio.
And thank you very much for those regular updates, Zandile, because really you have been, just doing some important work there. It's an important conversation to have at a critical time like this. So appreciate it. SABC specialist health researcher Zandile Myeza. They're live for us in Rio de Janeiro, that is in Brazil.